How's everybody doing? Welcome to, I think this is our sixth risk management roundtable. My name is Erin Wells. I'm from the University of Texas at Austin. I'm gonna let my other committee members introduce themselves.
My name's Sarah Shea. I'm Assistant Director of Facilities and Aquatics at A&M Commerce.
Lowe. I'm the Assistant Director for Strategy and Organizational Effectiveness at Ohio State.
My name is Loso. I'm the Assistant Director of Facilities Management and Operations at the University of Notre Dame. So we met as a group, as always, and came up with an agenda for us. But one thing we wanted to be conscious of is to make sure that we were covering the topics or questions or anything like that that folks had that they absolutely wanted to make sure we covered today. So we're actually just going to open it up to begin with and just let you pose a question either in the chat or just unmute yourself and be able to just ask that. And they can get the conversation going that way. And then if we don't have anything, then we will we'll take over and kind of just jump right back to the agenda. So if anybody has anything, feel free to start the conversation.
Okay.
Yeah, we got 7 seconds. You gotta always wait.
I was just curious what folks are doing with their bag valve masks. So we know that it's recommended to get the HEPA, but you can't get the HEPA. So what are folks doing for their BVMs?
Great question.
So what I've seen is a combination of things. People just doing their normal BVMs, nothing extra, trying to get the HEPA BVMs and just waiting for them to be available. And then 3, having that the mouthpiece kind of, or just an additional, I don't know, they're called Viramax filters.
Yeah, I just threw into the chat the filter that we bought, that UT Austin, our aquatics assistant director for aquatics, purchased for our BVMs. So I threw that up there for you. That's the one that we're doing. I think she just got those in a little bit ago and is working to get them on all of our BVMs. But that's what we're doing.
Thank you.
Yeah, no problem. Does anybody else doing something different? Was anybody else able to get the HEPA and got them from somewhere? Nope.
Yeah, I was able to get them. Honestly, I was very lucky working on the EMS side. So we were able to partner with them. They're helping us out. So I don't know if you can reach out to your county EMS system and see. I know here, our county EMS that I work for part-time, they partner with the local ISDs and buy all their medical supplies, AEDs, and things like that through them to where they do have a quicker access. I know a couple other people are working with their health centers on campus and trying to purchase through the health center because the health centers can get them a lot quicker. So those are just a couple of ideas. I don't know if they work on your campus or not, but that's what I've heard people have been doing as well.
Yeah,
Great.
we wanted to work with our health center on campus. They got us a few other things, but since they said that since we're not a health care provider, that they cannot morally provide those for us. So,
But even though technically your lifeguards are first responders?
yep.
Interesting.
Yeah, I tried to make that argument.
I'm sorry.
Me too.
Is there any other questions out there?
I'm just curious to see what other universities have added to their EAP in terms of a pandemic response clause, and what that looks like. And then also, are they then making that available to the public as well?
Do you mean like if somebody was to come into your facility and contract it, or they came into your facility with it and tested positive later, or if one of your staff members, is that what you're talking?
Yeah, so if you facility has had an exposure to the virus, although at the same point you are doing the proper cleaning, so essentially it should be virus free. What are you communicating out, and how are you handling those?
I know that's going to probably be one that's very specific university to university as to how they're handling it, because I know we're not writing those policies. We're actually getting them from the university. So I know that they are through our OHP. That's like our occupational health promotions office. They are in charge of getting the word out there. If something contact traced back to our facility, they would be in charge of letting the people know that could have been there during that time frame that they may have been exposed. Is that am I hitting on kind of what you're asking? Awesome, good. So I know we're doing everything through one of our departments on campus and working with them. And then we're also getting policy and procedure about if a staff member gets it or has symptoms or a preemptive positive, there's certain steps we have to go through. And then there's certain steps you have to go through to get them back to campus, to get them back on the job after. So, and that's all coming from our HR OHP office. Is anybody else doing something different?
As far as I know, our lawyers told us that we do not have to add anything additional to our waivers that we make all of our members sign. I don't know what we're doing in terms of staffing, but we're just being we're going to attempt to be really clear about our verbiage and the potential to contract this in this environment, but let everyone know the procedures we're taking to keep everyone safe.
Drew, are you getting that information from the university as well?
Yes and no. So we're definitely going to be doing contact tracing throughout the university, and that's going to be handled by a specific office on campus. We're still waiting to hear from general counsel on the waiver piece. One thing we have had to provide to both our risk management office and our general counsel's office is the exact programming and or informal recreation activity that we will be doing, because they are going back to make sure that from an insurance and liability standpoint that we are covered, and then also just kind of what that would change from a premium standpoint. The only other thing that I would kind of mention off of that is one thing that we've been very cognizant of and making sure that we are very clear of is posting, advertising, and informing the participant on the difference between it being clean, it being disinfected, and it being sanitized. Because there are three very different things and at very different levels. So we're just making sure that it's a shared responsibility and a collective responsibility of staff, users, and anybody from the university committee. But I know that that's one thing that we've really pushed hard, because it can't be done by one singular office on campus. So it's going to have to be kind of a shared collective.
All right, we have a question. Our county mandates temperature checks for all employees and patrons entering the facility. For anyone who has the same requirements, how will your first shift opening employees be screened, temperature checked? That's a great question.
Yeah.
Does anybody have policy and procedure for that yet?
Can you repeat the end of your question? Policies and procedures for temp screening for employees?
Yep, and it's for that first shift that comes on. So like your 6 a.m. crew.
Yeah.
Ross, you want to talk that through?
Yeah, our team at UT Austin has developed a web-based form that each employer, everyone who's coming to visit our facility has to fill out, and it's our way of contact tracing. So it's their name, their contact information, their purpose coming to our facility. So if they are a student employee, a full-time staff member, a participant, or a vendor, they have to fill out this form. And then our shift leadership, so our student leaders who open the facility will also be, there's 2 of them that will be identified as building coordinators each shift. They will be in charge of recording temperatures with a infrared thermometer and then entering that value into that web-based form. So all of the pertinent medical information is kept private, but the temp is recorded.
That's kind of a homegrown system. We like to do homegrown at UT Austin. So that it's not a software-based thing that we purchased.
But saying that, even though it is homegrown, it can be easily created through something like Google Forms with a linked document and a spreadsheet that links to all those values. So it can be grown in something like Google Forms.
This is Brenna. If I could just speak really quick, I'm from Missouri Baptist University, small school. So we actually have very similar for our employees this summer. We're doing the self-reported questionnaire and information for the contact tracing. I think right now we just don't have the part where there is an active live alert that's being, so I like that you're saying, and I want to make sure I'm understanding, you're saying that that's literally a form within your department. Like, are you receiving that information and so are aware if there is a symptom or an alert?
Yes.
Okay, because I think that's the piece that we're missing right now. So, okay, thank you.
Yeah, no problem. Is anybody else doing anything different? Drew, are you meaning to talk?
Yeah. Was I
Okay.
muted? Okay. The only thing I can add is we've had some conversations about the definition of visitor or guest or vendor or anything like that for our facility specifically. Understanding that we're going to have vendors come in and maybe replace or fix some equipment that's been broken. But one thing that we've talked about is, so we employ community members that may have other jobs outside of campus. So we have begun the conversation of right now, there's a potential that we may not allow them to come to campus and or come to work based off of we couldn't control what their potential job may bring to campus. So the conversation right now is how could we sustain those employee relationships and maybe even provide some programming opportunities virtually that would still allow those members to be on staff, and specifically thinking about the fitness realm, and then still provide opportunities for our patrons to still do the same type of programming.
All these crazy things you have to think about now. Yeah. Good. What else is on your all's minds?
I know we have this on the agenda, so I'm just going to throw it out because I'm going to put everybody on the spot. So thinking about aquatics and thinking about training, getting our staff back. Sarah, can you talk a little bit about, and Erin, you too, just about what the plans are in terms of your staffs coming back, being trained, making sure they're up to date, and then also maybe some things that you've had to go through to be able to do that.
Yeah, so we have a tentative date of the 13th of July. Right now, we have a lifeguard class going on, which is why I'm sitting outside because I'm watching. So I talked to a couple other colleagues, and I talked to the Red Cross, Jeremy, about how to get through training, because that's what we need, the water skills. And he sent me a clip from the Red Cross that says, unless you're they recommend the 6 feet unless your local government says otherwise. And so after talking to him, I typed up a document for our EOC, so our safety department on campus, of the days, the times that we would not be able to stick to the 6 feet rule for training. And I sent it to them and just got approval through them that if they would back us for these days and times and for these specific tasks, to kind of throw that rule out the window enough to train. I'm not 100% sure who they took it to past the university level. They required us to buy, we call them safety Sherman, the big old mannequin, use that as backboarding. So we added that to our training for extrication, but we got approval. It's for training only. So, and then real life rescue situations as well. And then right now we're going through training, and then we got approval for our 2 in-services days, probably gonna be 3. For the same thing. Anytime we're out of the water, we will be 6 feet. They will have a mask, gloves when needed. But once we get in the water, again, that part of the piece will be taken out, and we have prior approval in writing that they will support us and back us in case we get a complaint from a patron. We've had that situation in the building as well, because we are open. This is our 2nd week of the MRC being opened. And we've had some patrons kind of freak out on us a little bit about the 6 feet rule. So they're fine with it. They gave us approval for it, and this is the first day of training following the guidelines recommended from the Red Cross. It's gone pretty well. In-service will be a little bit challenging. Just the dry side is actually a little bit more challenging of how to teach and how to actually teach the CPR classes. We taught CPRO last week, and it was rough. Abdominal thrusts, and you have to do it on yourself, and to do 2-person CPR, you have to do it on 3 separate mannequins, and they have to act like there's someone to help you. So our instructors, luckily one is a coordinator, so he's taught for a while now, so he was able to, but we have a new instructor, so we had to take a lot of time to plan it out, because it is not easy to teach with the requirements that the Red Cross is having. We just finished our plan to open up for the pool to send to our EOC. We're sending it to them hopefully today. And the biggest things were spreading out our deck chairs. We decided to close off the spa. That's a big thing we decided. With the 6 feet rule and the way our spa is shaped, it's just not worth it. So we are shutting down our spa as phase 1 of the pool reopening. And then we have limited how many deck chairs we're going to have out. We have a brand new pavilion. Again, we're going to limit how many tables and where they're going to be, and kind of go from there. So it's definitely been interesting, but we're getting approvals. We're just having to do a lot of data and kind of back up a lot of stuff.
Sarah, how many people do you have in that guard class?
We have 6. And then for our C Pro, we only had 8. So our minimum's 10, and we had 2 instructors. So we haven't done a class yet with more than 8 people for that reason.
Do you keep one pair, they always do their rescues on each other, another pair always does their rescues together? Is that kind of how you're doing it?
Yeah, and yes, that's exactly how we're doing it. They're also everyone has their own tube. They're using the same tube. Everyone's keeping the same things. And then we're using safety Sherman as much as we can. I'm really excited about that. And so they're having fun with it. And then they're cleaning in between when we close down and they start doing their dry side stuff. They're using Virex to wipe everything down in between uses. The biggest thing will be the BBMs for practice. We don't have enough. We have enough for the 6 class, but we didn't have enough for the pro class. So in between usage, we sprayed them down and washed them, and just kind of broke down. It made the class a little bit longer because of all the cleaning in between, switching around things, but we were able to make it work.
Jennifer, does that answer your questions? I'm gonna go. Good. Awesome. Awesome. All right. I saw we had another question up there. Does anybody else have questions in regards to aquatics that we want to talk about and reopening pools and how that's looking, or Red Cross questions?
I did have a question about personal protective equipment and what you are going to provide your guards in general, if anything extra than what we normally would have provided them.
Great question. I'll go first. So our guards are also gonna, just so that we can keep them, as of right now, we don't know if our pools are opening, and we wanna make sure we can keep them on payroll. So I think they're going to, at this point, be acting as our response team in the facilities because they're the highest trained. So we bought them go bags instead of having the fanny packs. So if in case there is an emergency, they'll have a go bag, which has all of the equipment that a fanny pack usually does, and a little bit more. There's also a gown in it to put on just to protect themselves, and a face covering as well. The plastic face covering, sorry. They also, all of our student employees are gonna get masks. We have been able to source those, and gloves as needed. We're not going to make them wear gloves all the time. It's just kind of like that as needed, as they usually would. Did I miss anything, Ross? No.
So you mean like the shield, like the kind of shield that comes down and then? Okay.
Yep, that will be in the go bag. Mm-hmm. And that's for those major emergencies.
Thank you.
Yeah, no problem. So how are pools that share space with varsities handling those practices? I don't have to take care of that, so that's a good thing for me. But who does work with their varsity team, and what's that looking like?
So Jillian, our current plan, I believe, is to allow 2 per lane for our varsity swimmers. It's still kind of being worked out. Is there other questions you have regarding that relationship?
Are they doing 2 per lane starting on opposite ends?
Yes.
That's what I've heard a lot of, is 2 per lane starting on opposite ends. And they're probably going to have multiple practice times then.
Mm-hmm.
Splitting them up into their strokes, IMs, distance, sprints. That would be my guess as to what that's going to look like.
Yep.
Is anybody doing anything different?
USA Swimming released some really good guidelines for that for team practices, but it centers around a lot of having that extra deck space to space people 6 feet apart while they're out of the pool. But then
Jacob,
having multiple people in the water too.
Jacob, will you throw that into the thing if you could find it?
Yes.
Hey, Alex, what lifeguard training plan are you looking for? Alex Sperling. Sorry, Jillian, did you have more on that one?
I walk my dog near a local high school, and they have an auditorium, and there's some practice yesterday looked exactly like normal, with like 5 or 6 people per lanes. And that club, they're going through some renovations and now want to come to our facility. And I just don't think that expectation is going to be the same. And same with when our varsity team comes to our facility, wanting to be able to put 5 people per lane just doesn't feel right.
Jillian, do you manage do you all own and manage the facility, or is it a true shared facility?
No, we do not. We have separate facilities from athletics, but their facility is currently under renovation. So through the beginning of school year till November, the varsity swim team will need to share our space. And then after November, they'll be back in their own pool. So it's just for that first few months that they need pool time.
Gotcha.
And the university doesn't want them going off campus when we do have a pool on campus, because we're trying to keep people as close to the university as possible.
Makes sense.
Hey, Alex, which lifeguard training plan were you talking about? I'm sorry.
No, that's quite all right. So I was just wondering, those adaptations, if you have those all written out, I'm up in New Jersey, and as of right now, outdoor pools were allowed to open, I think, yesterday. Indoor pools are still absolutely not. So right now, everyone is basically relying on currently certified lifeguards. And so if we can put together a plan to say, here's how we plan on doing this as the summer moves on, that'd be great. But that's about it.
Yeah. So I know Kelly dropped the, Kelly Hungerford dropped the Red Cross, their resources in the chat. That's a really good one to look at. And then Sarah, are you willing to touch base with him? And
Yeah, if you just put your email in the chat, I don't want to share it until it gets approved by EOC, just in case they make us have a lot of changes, and I'll give you the updated one. But once it gets approved and we're ready to roll it out, I'll send it to you.
awesome. So is anyone out there using N95 masks? I'm gonna take that as a resounding no.
Marcus, I will tell you, anybody on our campus that uses a respirator of any kind has to go through a fit test and also a respiratory test. And that's done at our on-campus wellness center. That's for employees and anybody that has to abide by the university procedures. And they also have to take an online training module. So I don't know if that helps you or not, but that's what we do.
Awesome. Anything else aquatics related that anybody has any questions about? Or wants to talk about, chat about? Thank you, Jacob. All right. So the other thing we kind of wanted to talk about is staff training, and just kind of give you a little bit of update as to what some of our schools are doing. I can give you what we're doing here at the University of Texas. We're going to actually start some of this training next week to get them ready and get them back. We don't have an exact date yet for open. We're still waiting on that, but we want to be ready to go when we do have that. So next week, we're going to start with what we call our program assistants. That's our highest level students, because they're going to be the ones that are going to help do some of the other trainings as well. So we're going to start with the virtual training that I'm going to lead, and it's split into two different parts. The first part is going to be covering some of the HR policies in regards to if you test positive, how does that happen, what happens after that, how do you get back to work, all of that stuff. It talks about what is social distancing and why is it important. It talks about cough etiquette, hand washing etiquette, how to wear your mask properly, how to wear your gloves properly. What were some of the cleaning stuff that was done before they got back, and what is some of the upgraded cleaning that we're going to be doing going forward? What were some of the facility modifications that happened while they were gone? So introducing our plexiglass sneeze guard isn't what we're calling them. We don't like that phrase. I totally forget what it is right now.
Protective barriers.
Protective barriers. We're going to we're not going to handle their IDs anymore. So just kind of going through some of those facility modifications and procedures that they're going to see that are going to be different. And then what should they expect on their first day back? So going through, like Ross talked about, the new health screening and temperature checks and all of that fun stuff. So that's going to be kind of that first part of the virtual. The second part of the virtual training is going to be our safety. So because we haven't seen them in 3 to 4 months, I'm going to do a review of CPR, AED, and first aid, as well as I added a slide or two on, Has anybody done the Red Cross psychological first aid course, the 1 hour online? It was really good. I highly suggest it. It talks a lot about like how to deal with stress for yourself and knowing those stressors and the indicators and how to help with that. Yes, and it's free. So it was super easy to go through the slides, and it also helps you realize the stress from other people. So I know that Ross is going to use some of that in his presentation that he's going to do. I'll let him talk about that in a sec. So that's going to be that virtual training. I'm also going to go a little bit over the EAP, and then they're going to go in person. So they're actually going to see the modifications. They're going to see how we're going to do some of the procedures differently. And they're also going to do a crossover training. I'll let Ross talk about that because he's going to be the one leading that crossover training.
So for those of you who aren't aware, the University of Texas at Austin plans to open our 8 facilities in waves based on criterion as we hit them and we have staff back in site. So during all of them, or during the first phase of our reopen, a lot of our staff is going to be consolidated to working at 2 different locations, our main facility and then our only outdoor satellite facility that we're going to open during phase 1. So our trainings will encompass things like, for people who've never worked in our main flagship facility before, just the standard terms and verbiage that we use in that facility, the storage locations of equipment in that facility, the different modifications, as Erin had alluded to, that we've made. But then also a lot of them have never worked at our outdoor satellite facilities. And so we will teach them how to have conversations with participants who are on our facilities, who don't belong in our facilities. And a lot of that will be tied back to that Red Cross psychological first aid presentation. It helps you identify like how to manage people's stressors and your stressors during confrontations, because I just envision a lot of that when we reopen. People saying that we've been using this facility for the past 3 months and no one's had an issue with it. Why is it a problem now? And so we will be cross-training our staffs to be able to work in multiple facilities, again, to get our staff some hours and to get people an opportunity to work, but also to start reopening our facilities to our campus community.
So that's kind of like a snapshot of what it is we're going to start doing. And we think this is going to take us 3 to 4 weeks to roll through all the different levels of staff, from program assistants to building coordinators to our activity supervisors. So are these trainings taking place on Zoom? So mine, the 2 virtual trainings, will be taking place on Zoom. Are you filming or sending them? It's going to be live. So I have slides and I will talk it through with them live. So that's kind of how we're rolling that out. Does that answer that, Adriana? Good, awesome. What are other people doing to get their staff back, get them trained? What does that look like for y'all? Getting the word out there on the modifications and the procedural changes and all of that fun stuff.
Yeah, hey, we did, when we opened back up, we had a week's worth of training. So we did the first phase as a Zoom, going over if you're sick, kind of just the basics. And then our second one was, we literally went through the whole reopening plan with them. We didn't have a huge staff because we have modified hours, and then we're not busy. We don't have people on campus. So we were able to break it up. We had no more than 8 in a room because we had 2 of us, myself and the grad assistant, running the training. So we had to give them more options for them to come so that we could make sure we're staying within that 10 in a room. And then we went just step by step through the reopening plan that we gave our EOC, answered any questions. We also did a lot of deep cleaning days because they were ready to come back on campus. So we utilized them for those hours. So, and then the university put out 2 COVID-19 required trainings that we all had to do before we could step back on campus. So before they even walked into training, they had to show us a picture that they have completed those trainings for the university. And then they went through our training, and then after they went through our training, then they were allowed to help deep clean the facility for hours. And then we only 10 or less were allowed to work. We broke the cleaning shifts up, so we never had over 10 people in that space cleaning. the building.
Nick, 2 people at a time. How long is that going to take you to get through all that?
It wasn't too bad, honestly. Like, even with only 10 people at a time, like, they're actually pretty speedy cleaners, believe it or not. And even with training, it went by a lot quicker. I think the reason why is we constantly kept having Zoom meetings with them as we were preparing things. So they were kind of in the know of what was going on as we were going through it.
Awesome. I like the idea of the Canvas and the quizzes. Jillian, can you talk about that just a little bit?
Sure. So we utilize Canvas at Xavier, and we created a class for recreational sport employees that have shells for all of our different program areas. So we can push out content to all of our employees and then to the specific areas. So for all of our training manuals where we just want them to read information, knowing that if we send it to them, they might not read it, we've put those as assignments in Canva with embedded questions, but we're not telling the students how many questions there are. So they have to like actually read it to get their questions. And then their assignment will be putting the answers to those in there. And you can use a speed grader and it's really fast for that. And then for any of our videos, we will be allowed to be back on campus July 6th. So that week we'll be filming all of the video content for them. And that'll be put under modules by the shells. So for example, for my staff within aquatics, what does guard rotation look like? We'll actually be demonstrating that for them. And you can view how long people stay on a video. So if they only click into it for 5 seconds, I can say, hey, you actually need to watch this again. And then when they are in person in our small groups, we're going to do another assessment to make sure they've retained that information. Once they've completed everything that we've asked them to, giving them pay hours for that as well.
Hey, Tracy, Jillian, do you see that question from Tracy? How was the process of kind of laying the bones for that?
Yeah, so it was really easy. I just had to contact our IT help ticket to create the actual course itself. And then I've actually been an adjunct and I've had experience with Canvas, but they have a new faculty training program as well. So you can watch videos on how to create your modules and stuff. I have the majority of all of my section done, and it maybe took me just a few hours. It's really nice because when you create an assignment, you can set an assignment to a specific person or to a specific group of people. So if I have somebody that I am cross-training, I can select all the aquatics and that one person to have to do that assignment, which is that it was not hard to create at all.
We utilize Canvas as well, and it's very easy to navigate and very easy to work. I really think it's a great tool and a resource if your campus has it to kind of invest in, especially for trainings going forward. Like, we throw our student manual on there. They have to do the quiz for that. Our EAP quiz is on there. Like, all of the resources they would need are like right at their fingertips. It's awesome. There's no reason for them to like say, I don't know how to set up a volleyball standard, because there's a very detailed video for them. Highly suggest it. Cool. Is anybody else doing anything fun, unique for their trainings?
The only thing different we're doing for our trainings is we're covering all the same topics that everyone's been talking about, but we're having all of our professional staff, so even like our director and associate director, filming themselves, for example, like washing your hands, how to remove your face mask, so that the students that may not know who our marketing director is because they're lifeguards get to meet that person.
That's cool. That's really cool. That's awesome that they're doing that. Great. I know one thing that we had, what type of opening policies is anyone adding? Nick, can you ask that question to the whole group? Kind of, what do you mean by that?
Yeah, so like your open rec policies. So obviously, you know, you have pick up basketball and all that kind of stuff. And being up north, you know, we utilize our field house, and obviously like pick up soccer and everything's not happening. So what does that look like for some of you new ones? Luckily for us, we do have kind of a soft opening of just athletics coming in first for the first 2 weeks, and then just students, but we're already getting people who want to pick up, you know, full game basketball, rent our facility. So what kind of new policies are people adding to like kind of help with that open rec side of things?
So what are people doing for informal recreation, that drop in? Are you allowing it yet? Is that in later phases? What does that look like?
Thank you.
For phase 1, we said no basketball, no soccer. We do have our mat court still open, but we're not checking out equipment. So if someone brings a soccer ball and wants to kick her around, they can, but they can't play a game. And so we've like taken all the nets and everything like that down. Phase 2, we've decided to keep it the same way for right now. So really we have our weight room open, our cardio open, racquetball courts. We do allow table tennis. And then phase 2, we are proposing to allow racquetball one-on-one if they're from the same household, which is going to be hard to monitor. So I'm not 100% sure how that one's going to work yet. But the rest of open rec, we're not. When we open the outdoor, we have 4 outdoor basketball hoops. We're going to allow 1 person on each hoop to shoot around once the pool opens up. But that's all for right now.
As little as it sounds, are you giving those when you do table tennis? Are you giving them the paddles and everything, or are you strictly not giving anything out?
Yeah, we're giving out. We do have badminton set up too in our gym, so we're giving out badminton. Pretty much all of the paddle sports. We're just cleaning it before and after. They can bring their own, but if they bring their own, we require them to disinfect it in front of us using our stuff so that we know that it's clean. So we have the balls and the paddles and everything for right now. We haven't had a lot of people use it and take advantage of it, but our numbers have also been very low this last week and a half. So.
Hey, Sarah, do you have someone who's monitoring your outdoor court to enforce that rule? That 1 person per basket?
We will, since ours is tied to the pool. We don't have a fence separating it, so we're not open out here yet. But we will. We're going to have an additional lifeguard that when they're off stand, they will be monitoring and taking care of that. We've added guards out here because we also have the pavilion that'll need to be monitored as well. So we just have staff at 1 hour. So we're just going to designate whether it's a lifeguard or where it's one of our ops attendants inside, we'll put them out here to monitor it to where the lifeguards on stand won't be watching it.
Anybody else doing anything different for informal? Anybody allowing full court basketball yet? No. So we've had a couple fitness type questions. We had one earlier, and I'm sorry I didn't get to it earlier, but it was about the barriers in between equipment, the armistice shields. Is anybody going to be utilizing those going forward in their weight rooms, or where they're the large, almost non-movable machines are going to go? I've heard a lot about spacing out equipment, like utilizing gyms to move out, space out equipment. I know that Ross also put in here, UT Austin, we're throwing motorcycle covers over machines so that people can't use them. We didn't want to caution tape the whole place up, so making it look a little bit nicer. But I haven't heard a lot about the plexiglass shields in between the machines. We did in an aquatics call see one where they're dropping them in between lanes, and that was really interesting too. So I have seen that for aquatics and putting them in between lanes, but it doesn't sound like anybody's using those. And then Pat also had a question about sticking kind of on that programming. what are we doing with our group fitness instructors? Are we going to, first of all, are we hosting classes yet? Will we be hosting classes in our first phase? And then once we start hosting classes, will they have to wear a mask, or are they going to be behind a shield, a protective barrier? What are y'all doing for your group fitness instructors?
Hey, this is Jason at Southern Miss. Right now, we're going to open on July 1st. We are going to be running group exercise classes, but we have shifted them to one of our gym courts. We're going to be moving our sound system down there and kind of getting set up for that. At the moment, we're being told that all student staff have to wear masks, and that by perception would include the group exercise instructors. However, we're trying to see if we can maybe get an exception to that for several reasons. And one of those does tie into the fact that they still want us to have an option to do the classes virtually. So if you're not comfortable coming into the facility to take a class yet, have a streaming option. And so we're wanting them to still have the microphone and everything. We are ordering windscreens. You can get large bags of them from Amazon, so that we're going to give each instructor their own couple sets of windscreens that they can put on the microphones. That way that's not being shared, and adds a different layer of protection with that. So we're trying to get an exception to that, and then just keep the instructor back since we're on that court with enough social distancing, with them understanding that they'll need to have a mask for, right at the beginning when people may come up to them to ask a question, or, at the end, anything like that. But we're trying to get around that just a little bit. We're not going to have the ability to put a screen or anything like that up right at this point. But we're working on that currently.
Jason, are you all still, I think it was y'all, are y'all still thinking about F-45?
That we're still, at the moment, it's coming at some point. Now how we address that when it does get here, that's going to be very dependent. We're still looking at about 6 weeks before we even get the equipment here. So that's going to allow us a little bit of time, and things change every week, so I can't predict how we're going to be in when we get that going. So the game plan is that would still be up and going at some point in the fall, but obviously may be very different than the traditional model has been, or we may have to make adjustments or modifications.
Anybody else have plans for their fitness instructors yet? All right. Well, let's kind of stick on programming for a second, if that's okay with everybody. Is there any other programming type questions, like intramurals or sport clubs or outdoor rec? What are we thinking about when it comes to programming and risk management and protecting them? Does anybody want to talk about anything programming related, or do I mostly have facilities people in the room?
Hey, Erin, it's James Alexander from Loyola, Chicago. How are you?
Hey, good. How you doing?
Good. I have a club sports question. I'm very curious to see if what folks are doing to sort of mitigate their practices. I know obviously for most of the contact sports, in all probability, those are not happening this fall. But I'm thinking other sort of sports. What are folks thinking, or what are folks looking at with regards to some of the lower contact sports? Thanks.
Yeah.
Hey, it's Jason again. Last week there was a sports club roundtable, and that kind of came up with, which clubs are going to be resuming practice in the fall, which ones aren't. And the best advice that we really took away from that for here is looking at, a lot of these governing bodies have started putting out return to play guidelines for different sports. I know that USA Rugby's put it out. I think Ultimate has as well. Looking at that, seeing kind of what they advise and what they're, telling their clubs, and then, obviously comparing that with what your own institutional guidelines are doing. The big thing for us is very few of our clubs travel as is. So fortunately, we're lucky that, we're probably not going to be able to allow them to travel or anything in the fall, no matter what the club is. And so we kind of have a look at that. But looking at your policies on that, the one we're worried about and we're trying to figure out is we have a lot of dance-based clubs that use our group exercise studios. And like I mentioned earlier, we're moving our group exercise to a gym court. So depending when we get back in the fall, what our open rec guidelines may be, we may not have a space for them necessarily to do that if the courts are back open. So we're trying to kind of figure out with that, or if we have to limit, the number that can be at a practice. It's still up in the air for us, but biggest thing I can say is look at what some of those return to play guidelines are and see kind of how they mesh with what you got going on at your institution.
Good. Anyone else want to respond sport club wise?
As of right now, Xavier is looking at allowing practices to take place on campus, but the university hasn't made a decision on whether or not students are allowed to travel. They have said that professional staff, we are not traveling for the next fiscal year, and we do require a chaperone or a staff member to go with our student organizations. So that kind of puts that up in the air. But I was just curious on if any other universities are allowing student travel for this upcoming year.
I honestly only read our email from the university in regards to professional staff. So I can't, like you, professional staff is on a traveling halt. So my guess is that would trickle down as well to the students. I think Robert Weeks, can you talk a little bit about what the University of Cincinnati is asking of you and can you kind of talk about your comment just a little bit?
Yeah, sure. Basically what UC wants to do is provide spaces for students to go in between classes where they're not congregating into tight hallways or into a packed student union atrium or something like that. And so they basically looked at some of the biggest places on campus to say, where can we put, some tables and chairs spread around to allow people to go in between classes so they're not packing these tight hallways or tighter spaces. And so, we have 6 gym courts, so we're one of the biggest spaces. They also looked at one of the larger event spaces in our student union to take that offline for a year or however long. And then at one point they were also discussing the basketball arena on campus, but haven't heard anything about that. And so right now I'm kind of operating under the idea that we're not going to have the courts at all and trying to sort out how to maybe still spread out equipment and provide, for safety, but then also still provide, as much equipment available at a single time for our members as we can. So that involves taking the multi-purpose rooms offline, and I've already calculated out how, that we can get about 18 pieces of equipment in there, and it would just mean we'd have to keep all our group fitness virtual because we wouldn't really have any space for that. So that's just kind of what I'm looking at, really. Unfortunately, everybody else at my department is furloughed but me, so I'm kind of the only person figuring this stuff out. And yeah, so.
Wow. And Ross, you said we're just being asked to.
Yeah, right now today we went through an exercise to figure out like which of our spaces we would be able to accommodate that kind of open, spread out congregation kind of stuff. And all of our spaces are, Wi-Fi enabled, and so we have some opportunities. But the reason during our planning phase, we never thought that we were going to move equipment from like the weight room into a basketball court or one of our gyms was because we were like number 3 on a list to become an acute care site if we needed to, like a field hospital. And so that wasn't ever an option for us. And so now luckily we don't have to worry about, we were planning on moving equipment there. And now we have to figure out, okay, is this a viable option for us to become a spillover in between class hangout place?
Awesome.
We have the extra problem also of students who pay a student life fee getting a membership, but part-time students don't pay the whole thing, so they don't get access to the facility without paying it. And I've raised the question of, are we supposed to let in any student who just needs a place to go in between classes? Or am I supposed to figure out a way to somehow filter out people who are full-time and like basically almost have to move our entire check-in station to maybe somewhere on our fitness floor, because once you're in our building, you can go anywhere without being checked again for access to anything. So it's like a whole nightmare scenario of how do I, almost needing to get internet connection and secure computers up to a new place in the building, almost near an elevator, because once you're in the gym, you can take the elevator to the fitness floor. It's a mess. But I haven't gotten any clarification on that yet. So it's a real difficult planning right now. So hopefully we'll get some guidance from the university to sort that out.
Yeah. You want a cookie? All right. And then we had one last question coming in here from Jason about sport clubs, practices, waivers. What are y'all thinking in terms of waivers? I know that a lot of states need to think about if waivers are actually enforceable, because in some states you can't waive away rights or waive away health or waive away life and things like that. So just making sure you always take that into consideration. But is anybody thinking about doing waivers? I'm gonna take that as a no. All right. Any last minute burning questions we have? We're hitting the top of the hour here.
Anyone doing any special training for compressions only CPR?
No, we're not going to compressions only. Anybody doing anything different?
We're going to encourage compressions only for our lay responders, just because that's the guidelines that Red Cross rolled out. But we're not going to, for our professional responders, lifeguards and CPRO responders, we're going to encourage that they use the proper filtered masks, but we're not retraining anybody.
I know I've heard quite a few universities are moving to CPRO only. They're retraining everybody and going away from lay responder. I have heard that quite a bit. All right, anything else? So y'all, what do we think? Do we want to do another one of these? Are we thinking 2, 3, 4 weeks? What do y'all want? Leave it for us in the chat. And we will work with NIRSA if we're thinking we want to do another one of these and trying to get one on the books. Does that sound good to everybody? Awesome. Yeah, let us know what you're thinking. Let us know if you want another one. We really appreciate it. All right, looking like 2 weeks maybe. Yeah, thank you. 2 weeks, 2 weeks. 2 weeks. All right, y'all. Thanks for coming out. Stay safe the rest of this week. Try to get out and enjoy yourselves if you can. Bye.